The military field hospitals at UN peacekeeping missions are pledged by member states. Serbia, as part of the United Nations, has a Level 2 hospital in the Central African Republic, which has been operational since December 2014. About 72 medical specialists from the Serbian Armed Forces run the facility in the capital city, Bangui. This team is part of the 11th rotation of Serbian Blue Helmets serving in MINUSCA. Lieutenant Colonel Dr. Jovan Miladinovic is the hospital commander.
When we come to the hospital, we first have to see our hospitalized patient. So we start with visiting them. We discuss every patient during this our morning visit. And after we finish with our discussion, we are starting to do our daily tasks. We start to take care of outpatients.
The 24-hour Level 2 hospital is equipped to provide medical care to military personnel as well as UN civilians working in the country. These medical services include emergency surgery, intensive and high dependency care, and laboratory, pharmaceutical, dental, gynecology and orthopedic services, as well as aeromedical evacuations. In high-risk peacekeeping operations, the job is even more demanding. In the first 3 months of their deployment earlier this year, the Serbian medical team have provided UN personnel with critical medical care.
Since we started to work here from 27th of February, we have more than 2,500 patients, more than 150 patients with COVID, and more than 60 evacuations. And about surgery, we had 26 surgical procedures, and also we had 7 appendectomies. That's people that having very serious illness that was emergency, and that was a life-saving surgery for them. But you can imagine how much it was since 2014.
Most medics who support healthcare systems in peacekeeping missions have seen it all. Operating in this kind of field hospital comes with huge challenges, from helping wounded soldiers in the line of duty to offering critical on-the-ground medical care to frontline aid workers. Part of the work is dealing with fatal casualties, but nothing is more satisfying than to see their patients back on their feet.
Most satisfying moment, or let's say moments, was when some patient that was critically ill and that was evacuated from this hospital are coming back, and we see that he's alive and that we succeed to save his life. This is the big satisfaction that we feel, and that we are happy that we did our job in the right way.
Serbia has proudly partnered with the United Nations during the last 5 decades. They have close to 300 Serbian peacekeepers serving in UN missions around the world. In MINUSCA, the contingent has been recognized for their contributions towards peace in the Central African Republic. The force commander, General Daniel Siddiqui Traoré, presented a certificate of merit and medals for peacekeeping efforts to 72 members of the group, including 33 women, who demonstrated excellent service in the ever-challenging peacekeeping mission.
It's a unique opportunity, and every Serbian peacekeeper is very proud to get this medal from the United Nations. Serving for peace in the world is something unique, and we are very proud to be a part of the United Nations.
Serbian peacekeepers are also serving in MINUSCA in the Democratic Republic of the Congo, UNFICIP in Cyprus, UNTSO in the Middle East, and UNIFIL in Lebanon.